Most people think of routine medical tests as completely harmless, something you do to stay on top of your health. But what many don't realize is that even a simple, common procedure can sometimes carry hidden risks, especially when it involves delicate parts of the body like the neck. One of the most surprising examples is the carotid ultrasound, a test that's often done to check for plaque buildup or narrowing in the arteries that carry blood to your brain. On the surface, it sounds like the ultimate preventative measure, right? Detect problems early, fix them before they lead to a stroke. But here's where things get unexpectedly dangerous. The carotid artery, which runs along both sides of your neck, is not just another blood vessel. It contains sensors called baroreceptors that help regulate your blood pressure and heart rate. When too much pressure is applied during a scan, especially by an inexperienced technician or through repeated testing, it can overstimulate those sensors. That overstimulation can cause your heart rate and blood pressure to drop suddenly, which in turn can reduce blood flow to your brain. In some people, that's enough to trigger fainting, dizziness, or even a stroke if a small clot forms or circulation becomes unstable. I once saw a patient who went in for what was supposed to be a standard neck ultrasound. The scan was only supposed to last 10 minutes, but the technician had difficulty getting a clear image, so they pressed harder and for longer than usual. The patient felt a brief wave of dizziness, but didn't think much of it at the time. The next morning, he woke up with weakness on one side of his body and slurred speech, classic signs of a stroke. It was devastating because the very test that was meant to protect him ended up being a contributing factor to what almost took his life. This isn't to say carotid ultrasounds are bad. They're incredibly useful when done correctly. The issue lies in the lack of awareness around how sensitive the carotid sinus area truly is. Even a minor misstep, like excessive pressure from a stethoscope during a physical exam, or a tight collar pressing against the neck, can cause this reflex in people who are particularly sensitive. It's even more common in older adults whose arteries are stiffer and whose nervous systems respond more unpredictably. The danger is compounded when you consider that many people undergoing these tests already have risk factors like high cholesterol, hypertension, or early vascular disease, conditions that make their arteries even more vulnerable to small injuries or blood flow disruptions. The truth is, a test that involves direct pressure or manipulation of the neck should always be performed with precision and care. That means trained hands, gentle contact, and awareness that the neck isn't just a pathway, it's a lifeline. Every second your brain goes without enough oxygen, cells start dying and recovery becomes harder with every passing moment. So when we talk about routine tests, it's crucial to remember that they are tools, not guarantees. They can save lives, but only when done thoughtfully, with full respect for how sensitive the human body really is. When pressure is applied to the carotid artery, even for just a few seconds, something remarkable and dangerous can happen inside the body. This artery contains special sensors that act like the brain's internal pressure gauge. They constantly monitor blood flow and send signals to help regulate heart rate and blood pressure. Normally, this reflex keeps your circulation steady. But when the carotid artery is pressed too hard or too long, say during a medical test, a tight massage, or even when someone tilts their head in a certain way, it can set off an exaggerated response. The brain misinterprets the pressure as a sign that blood pressure is too high, so it sends out a signal to slow the heart rate and widen blood vessels. This sudden drop can cause blood flow to the brain to plummet, leaving you lightheaded or unconscious. In some people, especially older adults, that drop is strong enough to interrupt oxygen supply to parts of the brain, creating the perfect conditions for a stroke. What's especially concerning is how subtle the warning signs can be. A person might just feel a brief wave of dizziness, a sudden weakness in the knees, or a strange sense that the room is spinning. It's easy to brush it off as fatigue or dehydration. But in that brief moment, the brain may already be struggling for oxygen. When blood flow dips and rebounds quickly, it can cause micro tears in the vessel walls or allow small clots to form. Those tiny clots can then travel up into the brain, blocking smaller arteries and triggering what doctors call a mini stroke or transient ischemic attack. Sometimes that's just the beginning, and a major stroke follows within days or weeks. I've seen patients come in after fainting episodes during or after neck examinations. Many of them never realized that this could happen. In fact, carotid sinus hypersensitivity, the name for this overreaction, isn't rare at all. Studies suggest it affects up to 1 in 5 older adults, especially men over 50. It's also more common in people who take medications for high blood pressure because their circulatory system is already primed to respond strongly to any sudden changes. What makes it truly risky is that most technicians and patients don't discuss it before a scan. The focus is usually on checking for plaque or narrowing, not on what pressure during the test could do to the reflex centers in the neck. The key to preventing these reactions is awareness and technique. Gentle handling during scans, avoiding sustained pressure, and keeping the neck in a neutral position can all make a big difference. For patients, it means speaking up if you ever feel dizzy, lightheaded, or faint during a procedure, no matter how minor it seems. A few seconds of discomfort might save your brain from lasting damage. The human body is full of built-in safety systems, but when one of those systems gets overstimulated, it can turn protection into harm in the blink of an eye. Most people would never connect something as relaxing as a neck massage or a simple chiropractic adjustment with something as serious as a stroke, but in reality, the connection is more common than you'd think. The arteries in your neck, the carotid and vertebral arteries, are the main highways that deliver oxygen-rich blood straight to your brain. When too much pressure, twisting, or force is applied to those areas, it can cause tiny injuries in the vessel walls. These small tears don't always cause pain, so people walk away feeling fine, but beneath the surface, the damage may already have started. The inner lining of an artery, called the endothelium, is delicate and designed to stay perfectly smooth so blood can flow freely. But once it's torn or stretched, your body rushes to repair it, and in doing so, it can create a small clot. If that clot breaks loose and travels upward, it can block blood flow to part of the brain. That's how a simple neck movement can, in rare but very real cases, lead to a stroke. I remember one patient, a healthy woman in her early 40s, who went to get a deep tissue neck massage for stress relief. She left feeling relaxed, but later that evening, she developed a sudden headache and blurred vision. Within hours, she couldn't move her left arm. It turned out she'd suffered what's called a vertebral artery dissection, a tear in one of the arteries supplying the back of her brain. That one tear had caused a clot that cut off oxygen to a vital area. The message here isn't that massages or chiropractic care are bad, but that the neck is not something to be handled aggressively or impulsively. Even trained professionals can accidentally apply too much pressure if they're not aware of the warning signs or the patient's history. Another factor is repetition. People who regularly get forceful neck manipulations may develop chronic inflammation around those arteries, which makes them weaker over time. Add in risk factors like high blood pressure, smoking, or dehydration, and the arteries become even more fragile. The danger increases when the neck is extended or rotated too far, common during adjustments or stretching sessions. That twisting motion can briefly kink the artery, slowing blood flow and making it easier for a clot to form. Simple actions can help prevent this. Always make sure your practitioner is qualified and experienced in dealing with cervical areas. Avoid any technique that causes sharp pain, dizziness, or lightheadedness. And if you ever notice unusual headaches, facial numbness, or vision changes after a massage or neck manipulation, seek medical help immediately. It could be a warning sign of reduced circulation or a minor dissection before a larger stroke occurs. The brain relies on a constant, steady stream of blood, and any interruption, even a small one, can leave permanent marks. Taking care of your neck means taking care of your brain, because those arteries are its lifeline. One of the simplest and most powerful ways to protect yourself from the dangers of routine procedures is by taking an active role in your own care. Too many people walk into medical tests, scans, or checkups assuming everything is automatically safe. The truth is, even professionals can make mistakes or overlook small details that matter, especially when the procedure involves something as sensitive as the neck. Before any test or scan, take a few seconds to ask questions. Ask what the procedure involves, whether any pressure will be applied, and if it could affect blood flow or cause dizziness. You don't have to be confrontational, just curious. That simple moment of awareness not only protects you, but also reminds the technician to handle you with care. You'd be surprised how much more gently someone performs a scan when they know you're informed and paying attention. Hydration is another overlooked factor that can make a major difference. When you're dehydrated, your blood becomes thicker and flows more sluggishly through your vessels. That can make it easier for tiny clots to form or for your blood pressure to fluctuate more dramatically during stress or pressure on the arteries. Before any scan, especially in the morning or if you've been fasting, make sure to drink enough water unless your doctor specifically tells you not to. Hydrated arteries are flexible arteries, and flexibility helps prevent injury or restriction in blood flow when pressure is applied. Gentle handling is something both patients and professionals need to understand. If you ever feel discomfort, tightness, or pressure during a procedure, say something immediately. Don't assume that pain or dizziness is normal. For example, if a technician presses too hard during a carotid ultrasound or a nurse is drawing blood and accidentally leans on your neck, that momentary discomfort can signal reduced circulation or pressure on a critical artery. Speaking up early can stop a small mistake from becoming something serious. It's your body. No one knows what feels right or wrong better than you do. Even small daily habits can add up to better protection. Avoid sleeping with your neck in an awkward, twisted position or wearing tight collars and ties that press against the carotid area. When stretching or exercising, move slowly and avoid jerky neck motions that might strain the arteries. These simple habits keep blood flow smooth and reduce the risk of accidental irritation or injury to the vessel walls. Preventing complications isn't about being fearful, it's about being mindful. You don't have to refuse tests or procedures that can help you. You just need to make sure they're done safely, with attention and respect for how the human body works. The more you communicate, the safer your experience will be. Doctors and technicians appreciate patients who care about their own well-being because it leads to better outcomes for everyone. Every time you take a moment to ask, prepare, or speak up, you lower your risk and strengthen your control over your own health. When it comes to protecting your brain and reducing stroke risk, one of the most powerful tools you have is not a pill or a scan. It's your plate. The foods you eat directly affect the health and flexibility of your arteries, the strength of your blood vessels, and the quality of your circulation. Your arteries are lined with a delicate inner layer called the endothelium. Think of it as the skin of your blood vessels, the surface that keeps blood flowing smoothly without friction or clots. Over time, this lining can become inflamed or damaged by poor diet, high blood sugar, smoking, or high cholesterol. But the good news is certain foods can help heal and protect it, reducing the risk of the small tears or blockages that lead to stroke. Let's start with blueberries. These little fruits are packed with anthocyanins, natural compounds that protect your blood vessels from oxidative stress. They help the endothelium stay elastic, which allows your arteries to expand and contract easily when your heart pumps blood. People who eat berries regularly often have lower blood pressure and better circulation because those antioxidants literally help the blood flow more smoothly. Then there's pomegranate, often called nature's artery cleaner. Studies show that pomegranate juice can reduce plaque buildup and even reverse some of the oxidative damage in the vessel walls. A small glass a few times a week can improve blood flow to the brain and heart, helping to prevent clot formation. Olive oil is another powerhouse. It's rich in healthy fats and anti-inflammatory compounds that calm down irritated vessel walls. When arteries are inflamed, they become sticky, making it easier for cholesterol and platelets to cling to them and form clots. Olive oil acts like a soothing balm, reducing that stickiness and keeping your arteries smooth inside. The same goes for omega-3 fatty acids found in fish like salmon, sardines, and mackerel. They lower triglycerides, stabilize heart rhythm, and prevent blood from becoming too thick. A diet that includes omega-3s 2 to 3 times per week can dramatically lower your stroke risk by improving both the quality and flow of your blood. And don't forget green tea. This simple drink, when consumed daily, improves blood vessel function and reduces LDL oxidation, the type of cholesterol damage that narrows arteries. It's like giving your circulatory system a gentle tune up each day. Even just 1 or 2 cups can make a noticeable difference over time. It's amazing how much control we actually have over our vascular health. Every bite and every sip either strengthens or weakens those vital channels that deliver oxygen to your brain. You don't need expensive supplements or extreme diets, just consistent, natural nourishment. When you combine these foods with good hydration, regular movement, and mindful medical care, you create the perfect defense system against stroke and other circulatory problems. The goal isn't just to live longer, but to keep your brain sharp, your energy stable, and your future clear. What you eat today can literally determine how clearly you think tomorrow.